Sleep Education and Behavioral Therapy for Older Adults with Insomnia. Tracey, Hampton, Colorado Mesa University, Nursing 220, Spring 2015. We'll begin with background and significance. The American Psychiatric Association defines insomnia as difficulty in initiating or maintaining sleep, non-restorative sleep, and as causing clinically significant distress or impairment in social, occupational, or other important areas of functioning. Sleep education. In this section, we will learn about sleep drives, sleep-promoting behaviors, and behaviors that interfere with sleep, as well as environmental changes in our sleeping environment to improve sleep. Why is this important? It's estimated that 50% of all adults over age 60 will have insomnia at some time. This could be short-term insomnia that resolves on its own, episodic insomnia, comes and goes, or chronic insomnia. Sleep cycle changes begin at age 40. They can result in changes in sleep times and quality of sleep. Medications prescribed for sleep are usually not recommended for long-term use. Many of those medications aren't recommended for patients over age 60 due to side effects and increased risks. Continuing why this is important. Once sleep medication is withdrawn, insomnia can return. Behavioral interventions are as effective as sleep medications in total increased sleep time. Benefits of behavioral interventions continue after completing behavioral change therapy. What are some risks associated with sleep medications? Sleeping medications carry an increased risk of decreased cognition, including memory loss, an increased risk of falls and hip fractures. It is outside prescribing guidelines to prescribe sleep medications for patients over 60 oftentimes due to these potential risks. Tolerance. This means a current dose may no longer be effective, requiring increased dosing. Dependence. Drug dependence. 3 objectives of this program are: the patient will be able to identify signs of sleepiness. Number 2, the patient will be able to differentiate activities that promote good sleep and activities that interfere with sleep. Number 3, the patient will be able to describe the steps in stimulus restriction therapy. Sleep changes. As people age, there's a change in their sleep cycle affecting their circadian sleep drive. It starts about age 40. Sleep changes. Older people become tired earlier in the evening and usually waked earlier in the morning. That in itself is not a problem as long as sleep is restful and an adequate amount of sleep. Sleep changes. Changes in circadian drive lead to sleeping less deeply, which can result in middle-of-the-night insomnia, simply waking during the night to go to the restroom, but then unable to fall asleep easily. Consequences of insomnia. Feeling tired in the morning. Waking feeling unrested, having tired and achy eyes. Hypersensitivity to noise and light. Mood disturbances. Feeling grouchy, irritable, interacting differently with family and friends. Feeling isolative, not engaged in activity the individual usually finds enjoyable. We're going to discuss 2 components of sleep: the circadian sleep drive and the homeostatic sleep drive. The circadian sleep drive, that is your body's internal clock. Circadian rhythms refers to changes that occur over a 24-hour period These are driven by an internal clock and they're synchronized with the external environment. The internal clock either promotes staying alert and awake or falling asleep. When the circadian sleep drive is disrupted, sleep may be delayed, disrupted, less restful, or even increased sleep. The homeostatic sleep drive is an internal sleep drive. Pressure to sleep increases with each hour that you're awake until a threshold is crossed, causing sleep to occur, usually after about 16 hours of wakefulness. After your sleep, waking occurs when the hemostatic drive has reduced sufficiently. Behavioral interventions. In this section, we're going to discuss healthy sleep habits, changes in environment, and changes in behavior. Behavioral changes. Sleep promoting behaviors that one can adopt. Avoiding sleep disrupting behaviors. Changes you could make to your environment to promote sleep. Waking at the same time and going to sleep at the same time each day. Keeping a regular schedule even on your days off. Waking at the same time daily, even if you've had an unrestful night, is important to maintain the regularity of that cycle. Also, preparing for bed and turning out the lights to go to sleep at the same time each night. Which of the following sleep drives is your internal clock? A, the homeostatic sleep drive, or B, the circadian sleep drive? There you are. If you said circadian sleep drive, you are correct. Establish a bedtime routine. Perhaps you want to start with locking up for the night, or changing into sleep clothes, brushing your teeth, reading for a short time, having a light snack, or getting clothes prepared for the next day. The details of your routine aren't as important as the process of preparing for sleep. What's important is that you have a routine and you stick to it at the same time in the same order every night. This is part of retraining your brain. You'll have this 30 minutes to an hour for your brain to wind down and prepare for sleep. Sleep hygiene. Limit all caffeine. Caffeine is contained in soda, coffee, tea, and chocolate. Caffeine can cause difficulty falling asleep, waking during the night, and light sleeping. Even early in the day, caffeine can interfere with sleep for some people. Smoking. Nicotine is a stimulant. Smoking is a hazard to your health. It also can interfere with your sleep. Try not to smoke during the night if you're up. Sleep hygiene. Moderate exercise is good for your mental health and physical health. It can also improve your sleep. It's recommended that you exercise at least 30 minutes a day for 3 days a week. You'll want to avoid exercising right before bedtime, as this can delay your sleep. So exercising earlier in the day, about 3 to 4 hours before sleep is the latest you would do that. Today's question: why is it important to establish a bedtime routine? And of course that answer is the reason it's important to have a bedtime routine is that schedule is important to retrain your brain. True or false? Right before bed is a great time to take a brisk walk on the treadmill. Of course the answer is false. Moderate exercise is in fact good for your health. But you want to do your exercising at least 3 to 4 hours prior to bedtime. Don't be a clock watcher. Watching the clock can increase your anxiety and interfere with getting to sleep. You could turn your clock around, cover it up, or put it under the bed. Either way, Don't be a clock watcher. Sleep environment. An uncomfortable bed is not a good sleep environment. It definitely could interfere with sleep. Choosing a comfortable bed with bedding and pillows and blankets that are all very comfortable and encourage restful sleep. Also, keep your room cool and dark to encourage sleeping. Things that interfere with sleep. Alcohol. Avoiding alcohol, especially in the evening. While alcohol can help tense people relax and fall asleep, it can cause waking in the middle of the night and rebound anxiety. Napping. Napping can interfere with sleeping at night. It can decrease your homeostatic drive for sleep at bedtime. If you find that you must nap, a cat nap no longer than 1 hour prior to 3 p.m. is ideal. Things that interfere with sleep. Using devices with screens before bedtime distracts from going to sleep. It's too easy to lose track of time watching the screen, checking Facebook, the latest weather, texting a friend, or watching just more and more episode of your favorite rerun. Then before you know it, you've spent an hour lost in the screen. Screens on computers, cell phones, and TVs emit blue light that's found in the light spectrum during the daytime hours. It can actually send signals to your brain that it is alert time. So, no screens at least 1 hour before. Stimulus restriction, also called stimulus control, is based on the idea that some people with insomnia have learned to associate the bedroom with staying awake rather than sleeping. This therapy is used to break negative associations of the bed as a place of frustration. We'll go over the steps really quickly and then we'll go over them in depth in a moment. Use your bedroom for sleep and sex. This is part of retraining your brain. Maintain your schedule. When you go to bed, go with the intent to sleep. Continuing those steps of stimulus reduction. If you aren't asleep in about 15 minutes, and you are going to estimate this because you're not watching the clock, then get up. Do a quiet activity until you become sleepy. Quiet activity that isn't stimulating. When you do feel sleepy, go to bed with the intent to sleep. Repeat as needed. Quiz. We're going to choose the best answer. You know you are sleepy when A. It's 9 p.m. B. Your eyes are droopy and you feel the need to sleep. C. The news is over. Or D. Right after your last cocktail. And the answer is correct. Your eyes are droopy and you feel the need to sleep. Warning. Practicing stimulus reduction may involve getting up several times during the night. You will be tired. Use caution. Think before you drive, make decisions, or use equipment. You may be reducing your sleep time. If you have long-term insomnia, retraining your brain could take 4 to 8 weeks, and during this time, you might have some nights that you get up several times during the night before you finally get to sleep. So use caution. Why would I want to do this? You're asking yourself. Well, once you've retrained your brain, continue using good sleep hygiene and avoid sleep interfering activities, the benefits of improved sleep usually continue. And the bottom line is, the reason you would do this is to have improved sleep. 1. Use your bedroom for sleep and sexual activity, minimizing all other activities, meaning no eating, no working, no computers in your bedroom. This stops the competing activities for your brain and stops the competing stimulus. It triggers your brain to feel tired and prepared for sleep when you're in your bedroom. Go to bed with the intent to sleep. When you turn off the light, that is a signal to your brain that it's time to go to sleep. Lights out, ready for sleep. If you aren't asleep in about 15 minutes, and remember, we're going to estimate that because you're not watching the clock. When you're not asleep in about 15 minutes, you're going to get up. This changes the signal of being in bed, sleepless and frustrated, to another room. So when you're in bed, your brain gets a signal that it's time to go to sleep. While you're up, do a quiet activity until you're sleeping. A quiet, calming activity, nothing too stimulating, and certainly no television. You may try listening to music, reading, or knitting. Not all of those things at once, so limit your activities. But you'll do that until you become sleepy. When your eyes are drooping and you feel the need to sleep, you return to bed. Repeat as needed. You may need to do this several times a night at the beginning, but it's part of retraining your brain, and that repetition and that routine will retrain your brain. Sleep diary. You'll document each morning when you wake and each evening prior to going to sleep. At bedtime, you will document what time. In the morning, you'll be documenting what time you went to bed the night before, what time you woke up, the number of hours you slept, and the number of times you were up during the night. At bedtime, you'll document the number of servings you've had throughout the day, the time of your last caffeine, and the number of minutes exercised that day. I've also placed a spot in there for symptoms. Anything you noticed. Are you tired after 3 p.m.? Are you short-tempered? So that's an extra spot if you have additional symptoms that you'd like to document. Then we can review this. It's a good reference. We can make adjustments to your activities and identify any problem areas with this document. Fill in the blank. When practicing stimulus reduction, you should go to bed with you should go to bed with the intent to sleep. Key points of this presentation are: insomnia affects approximately 50% of all older adults over age 60 at some point. Sleep improvement can continue after you've completed your initial training. And finally, behavioral changes are an effective treatment for insomnia. And now, any questions?